Our group will be reviewing the effects of silver diamine fluoride on overall health and quality of life in various populations. My name is Yasin Jang.
My name is Diana S.
And my name is Daisy Saldana.
And Jennifer M. So today we're going to be talking about the abstract, which mentions purpose, methods, and results. We want to talk about the ingredients in SDF, which are silver, ammonia, and fluoride. This has become a new innovative dental treatment to improve the quality of life of patients with caries that are high risk, to treat dental decay. And although it is innovative and new, that also comes with it not working for everyone. So the methods to use this is to clean the tooth and dry it off, then apply the SDF with the microbrush directly on the carious lesions, allowing the SDF to slow down the progression of the dental decay. It is supposed to kill the bacteria causing decay, and the fluoride will help strengthen the tooth. We also disclose to the patients that the oxidation of the SDF will result in irreversible black staining. Results that we found were that many of the studies show the correlation between quality of life and the use of silver diamine fluoride being positive. Patients who have not immediate access to traditional forms of care, such as restorations or other forms of caries control, may benefit from this therapy. It is also low cost and relatively safe to use. Many individuals ranging from pediatric to geriatric can benefit from this comprehensive management, where individuals' needs and risks are taken into consideration.
The problem statement of our project is, how does silver diamine fluoride improve our health and quality of life?
I will be discussing the evidence gathered in support of the correlation silver diamine fluoride has on individuals' oral health-related quality of life across diverse patient populations, including pediatric, special needs, geriatric, and medically compromised individuals. Our first piece of evidence is a literature review, and it highlights the negative impact dentin hypersensitivity has on individuals' quality of life. The sensitivity may impair social interactions and basic needs such as eating and sleeping. Our second study is a prospective pilot study. And what it is it sampled children using an early childhood oral health impact scale to assess the impact that silver diamine fluoride has on their quality of life. Post the SDF treatments, the results displayed a clinically significant finding that there was a lowering on their oral health impact scale, demonstrating improvement.
The next piece of evidence that we have is the randomized controlled pilot trial study. It found that SDF significantly lowered gingival inflammation and plaque levels compared to the control group. This suggests that SDF could be an effective tool for improving oral health, especially for older adults in retirement settings. The fourth study is the scoping review design study. And it mapped literature on the relationship between tooth retention, overall health, and quality of life in older adults, finding a strong positive correlation among them. However, it didn't draw a definitive conclusions through statistical analysis. Despite some uncertainty about the cause and effect direction, new research insights seem promising for clinical decision-making and caregiving. The last study was the parallel design with 2 intervention arms. It aimed to evaluate the desensitizing effect of the 38% silver diamine fluoride versus 5% potassium nitrate on hypersensitive teeth in older patients. Results showed median sensitivity reduction of 60% for SDF and 50% for the potassium nitrate. This evidence suggests that SDF may become the new standard care of dental hypersensitivity.
I will be presenting on 2 case studies that demonstrate the effectiveness of silver diamine fluoride, also known as SDF, in arresting dental caries and improving patients' quality of life. life. So the first case study that we're looking at today is including a immunocompromised patient. So this was an 18-year-old woman with secondary Sjogren's syndrome, systemic lupus, and rheumatoid arthritis. So due to her medical condition, she was at high risk for dental caries. This patient had multiple advanced caries. So what they did was they treated these caries with silver diamine fluoride paired with glass ionomer to give sort of an aesthetic look. And out of 8 teeth affected, 7 of them were successfully treated with this approach of SDF paired with glass ionomer. So that's 7 out of the 8 teeth that had caries. The second case that we're looking at was in older adults with root caries. So this second case focused on the effectiveness of SDF at arresting root caries in adults 55 and older. So these participants received a 38% silver diamine fluoride application on root caries surfaces that were active. Reapplications were conducted every 6 months, so reapplication of the silver diamine fluoride. And by the 18th month follow-up, the study reported an arrest rate between 82.9% and 91.6% success of the caries arrest. So the main takeaways from these case studies are that SDF offers an effective, non-invasive alternative to traditional restorative treatments. It also significantly reduces the need for traumatic procedures, which also can improve patients' quality of life while they're going through these hard times. And silver diamine fluoride also is pretty affordable and accessible for older populations. It's great for preserving their teeth and just maintaining oral function while they go through these periods of life.
Silver diamine fluoride is a minimally invasive, cost-effective dental caries treatment. It is used to effectively arrest carious lesions, reduce sensitivity, and improve quality of life. It enhances dental health while minimizing the discomfort of dental decay and the risks associated with traditional interventions, and it's all done with ease. While further research is called to assess silver diamine fluoride's long-term effects, current findings suggest it offers a practical, safe, and effective alternative treatment for those who may struggle with traditional invasive procedures.